We begin this morning with new travel restrictions for people looking to enter the United States. New rules took effect a few hours ago aimed at slowing the spread of the Omicron variant. Travelers coming to America, including U.S. citizens, must now take a COVID test within 1 day of their departure. So Laura Podesta is here with what we need to know before taking our next trip and what health officials are saying about this new variant. Good morning.
Good morning, Anne-Marie. Well, a big question that remains this morning is how transmissible is this new variant? How quickly or easily can others catch it? And with that and other unknowns surrounding Omicron, the U.S. is taking new steps to stop the spread. As of this morning, all travelers coming to the U.S. must undergo a COVID-19 test within 24 hours of their departure. Previously, they had to be tested within 3 days of their flight.
Definitely another challenge that's coming up in the way for travelers.
The tightened restrictions come as the Omicron variant continues to spread. At least 17 states have reported Omicron-related infections. Many of the confirmed cases have been found in vaccinated people who reported having mild symptoms.
But we really got to be careful before we make any determinations that it is less severe or really doesn't cause any severe illness comparable to Delta. But thus far, the signals are a bit encouraging regarding the severity.
Experts say, though, it's still crucial to determine if Omicron is more transmissible than other variants.
Even if it is a mild disease, it's important that we still act fast now to take measures to control its spread, because even if we have a large number of cases that are mild, some of those individuals will need hospitalizations, they will need to go into ICU, and some people will die.
Omicron's arrival has coincided with a spike in new COVID cases, up 19% in just 2 weeks. The number of new infections now tops 108,000 a day. The CDC says 99% of those cases are caused by the Delta variant, with unvaccinated people remaining the most at risk. Some promising news about Omicron, Anne-Marie. Reports from South Africa, where it emerged and is becoming the dominant strain, suggest that hospitalization rates have not increased alarmingly.
Well, that's at least some good news. I know when it comes to testing, sometimes people can apply for exemptions. Is anyone exempt from having to get tested before entering the country?
Yes, there are several categories. For example, children under the age of 2 don't have to be tested, nor do people who can prove they've recovered from COVID within 90 days of entering the U.S. This requires, of course, results of a positive COVID test and a letter from a doctor or a public health official that says the person is cleared to travel. As well as airline crew members, they're exempt as long as they're following the FAA's coronavirus protocols. That means quarantining or isolating after being exposed to the virus. And military personnel are also exempt if they're under official orders to travel. This also applies to federal law enforcement officers. And the final exception to talk to you about applies to humanitarian workers in case an emergency arises.
I know that there are a couple of different tests that you can take here that are available to you. I can't imagine how many different options there are throughout the rest of the world. What kind of tests or what kinds of tests can travelers take in order to get into the country?
Yeah, if you're traveling for the holidays and you want to know definitively what can I take, what will help me get back to the U.S. after I see my family, the CDC has published criteria for a test to be valid for entry to the U.S. So you want to check out the CDC's website. All of them are viral-based tests. Antibody tests are not allowed, and home tests are acceptable as long as they've been authorized by either the FDA or by another relevant authority in another country. Anne-Marie.
Okay. Laura Podesta, thank you very much.
Thanks.